Great. Hi guys, Dr. Stephen Greenberg. How are you? Welcome to our Cosmetic Surgery Night of Beauty. We're here with Dr. Saba, Dr. Stark, Sarah Donahue, our head PA. We're going to talk all about cosmetic surgery. We'll cover everything from head to toe, and we are taking your questions. So if you have any questions that you want to talk about tonight, just direct message us on Instagram or go to Facebook and ask your questions of any of us. Let's talk a little bit about cosmetic surgery in general. Dr. Cooper is coming right in too, one of our esteemed plastic surgeons, and here she is. Guys, get all closer together here. Let's talk about what's going on now in cosmetic plastic surgery. Well, we have seen a tremendous growth over the last several years in cosmetic surgery procedures. They go up every year. And this year, 2020, early 2021, is even a more exponential growth. So we're seeing huge growth. And why is that? Because the procedures are easier to perform than ever before. The recovery is better. A lot of people now, because of the pandemic, are home and can recover easier. But even without that, recovery is so simple in most of these procedures.
Yeah, I think the pandemic had a lot of influence on people really looking at themselves and having the time to do more things. So they're coming in and putting more focus on what's bothering them. And recovery is in beds, even if you don't have the downtime or you don't have time off. Recovery for breasts is quick, recovery for belly is quick. We can accommodate you to whatever you need, and in your downtime, we can customize each procedure for you.
Yeah, we're going to talk a lot about the individual procedures, but we're seeing growth in not only women, but we're seeing growth in men as well.
So a lot of men are not only staring in the mirror, they're looking at their wrinkles. They also have a lot of concerns with gynecomastia or fullness of their chest. A lot of liposuction for men too. This is a quick office procedure that we can perform here.
And we do most of our procedures, Dr. Cooper, in the office ambulatory center.
We do, and we have 3 full operating rooms. We have amazing anesthesiologists that actually come from Good Samaritan Hospital. I would trust any of them to take care of any family members. And it's a safe, wonderful environment, and we have a full recovery room. We even have an overnight recovery room suite if the patients want to stay overnight, and they get a nurse to stay with them too.
So it's very important to realize, Dr. Saba, that these procedures, because of technology and because of our experience, we do these all day long, every day, recovery is faster than ever before.
And, I'm glad you brought that up, Dr. Greenberg, because recovery really is the key word. And with the COVID pandemic, with the uptick in people having to wear masks, we've actually found a huge increase in the number of people coming in for rhinoplasty, because a lot of the recovery involves, dealing with the swelling in the nose after a rhinoplasty. With people having to wear masks, that's actually made it a lot easier for people to kind of not have to walk around with as much swelling, and it kind of softens the landing after a nose job.
Well, I'm glad you brought up rhinoplasty, Dr. Saba, because you're certainly the rhinoplasty expert here, and you do these all day long, every day. The changes in rhinoplasty over the decades has been dramatic because we like a really natural result now.
Absolutely. So there's been a lot of talk about not just doing one type of a copycat nose for everybody. We customize everybody's rhinoplasty to their facial contours. We also customize it to what the patient likes, so long as, of course, it matches with their facial contours or proportions. Additionally, we're talking about, modern evolution of rhinoplasty. This is something that we are going to be doing a lot more of, but using a lot of new equipment in terms of the piezoelectric, which uses ultrasonic energy to shape the nose in a very non-traumatic way.
We also do computer imaging for a lot of different procedures, including rhinoplasties. So we actually can show somebody what they're going to look like, to the most part. They're not exact, for the most part. Now, Dr. Saba mentioned the use of masks and how that's changed recovery, because it certainly has. We do a lot of different things to the face, whether it's surgical procedures or non-surgical procedures. And several of the non-surgical things that we do involve different injectables.
Yes, there's a big focus on the face now, especially non-invasive treatments, because everyone's wearing masks and everyone's focusing on their wrinkles and their laugh lines and their smile lines. So Botox is great for the top third of the face. So forehead lines, glabella lines, or 11 lines here, and the crow's feet. And then we do a lot of fillers for the bottom 2/3 of the face. So lips, nasolabial folds, cheeks, jawline in men. We're doing a lot of Kybella now too, so you can still see the neck even with the mask on. So Kybella is great to non-invasively and permanently dissolve the fat here.
And there are different types of injectables that we use, tons of different types, and we really individualize these procedures when a patient comes in to figure out what we think would look best in different areas of the face.
Exactly. So the different fillers, like Dr. Greenberg was talking about, we have every FDA company here in our office. We have lots of variety, and it's a fancy word, but it's the rheology of fillers. So they are components of elasticity, durability, and softness. So something that's soft and elastic, we'd use that around the perioral area or the lips, because we want you to look natural and move with your filler. You'd also use that in the nasolabial fold area. If you want to build mid-face volume and cheeks, you would use something that's a little bit more durable that goes down to the periosteum. A lot of mid-facial volume loss or even pan-facial loss can be replaced non-surgically. And you would come in and within 5 minutes, you would look rejuvenated. It's pretty amazing.
Now, so we kind of individualize this procedure. A patient comes in and says, I feel old, I want to look better. So what we need to do is figure out for that patient, with that patient, what will help them look better. So a lot of times patients can do a little filler along the jawline to camouflage the jowls. A lot of times, as Dr. Stark and Sarah just mentioned, we'll fill up the laugh lines or the marionette lines, give cheekbones. We do non-surgical rhinoplasty. So without surgery, we can camouflage a bump on the nose. So there's tons of things that we can do. Now, in combination with our ability to use injectables and Botox and any type of injectable for the face, we often will do non-surgical things as well, such as oil therapy to help tighten up the skin, rejuvenation using a J-plasma laser, which is a newer type of laser to help tighten up the skin, as well as resurfacing the skin as well to smooth out their fine lines and wrinkles and to get rid of sunspots and brown spots in our full med spa here at the Greenberg Cosmetic Surgery Centers. All right, we're going to flip a little bit to the surgical alternatives now. The surgical alternatives for the face, working from top down. The eyelids are one of the most common surgical procedures, Dr. Cooper.
They absolutely are, and we do tons of them here, and they're also done in our ambulatory surgery center. It's a really quick procedure. Upper and lower eyelids can be done in the surgery center, and they take, for uppers and lowers together, it's about an hour, and the patients are really surprised at how well they feel and how little they bruise after we do the surgery. It comes down to experience, and oftentimes we'll combine blepharoplasty surgery with some of the non-invasive modalities with filler. It comes down to talking to our patients and trying to figure out what is the best approach for them to reach their goals.
Listen, I think the eyes give away age more than any area of the face. So everyone looks at someone's face and says, well, what is making them look old? And I think the upper eyelid skin, the lower eyelid puffiness or extra skin makes a huge difference in someone's overall appearance. But sometimes we also have to address the rest of the face as well. And we can do that with little mini lifts, little mini facelifts, neck lifts, or regular facelifts. And an incision for a facelift, Dr. Saba, is made where?
So incisions for a facelift, whether it's a mini or whether it's a full facelift, you start off with an incision right in front of the ear, and we make every effort to hide the incisions within the natural contours between the ear and the cheek so that the incision is not so obvious. If you're going to do a full facelift, you would take that incision that's right around the ear and you would extend it to right behind the ear, and that allows us the ability to tighten the muscles of the neck as well as get a nice contour for the jawline.
And sometimes, Dr. Stark, we can just contour the neck.
Yeah, so with the almost very similar hidden incision around the ear, a little bit in front and behind, we can lift that neck. So a combination, which is beautiful with liposuction. So if you feel like you have fullness underneath your chin, we can combine that with liposuction and then really redrape the skin around your neck for a nice contour. So you have a more acute cervical mental angle that looks beautiful from the side.
Well, cervical mental angle means what? The jawline, the neckline, right?
Yes.
Okay, that, the angle here, for those of you guys who aren't plastic surgeons, we can tune up that neck by doing a little lift. So there's a lot of things that we can do, like we call it a mini lift or a micro mini lift. We also use a lot of thread lifts to help tighten up the face in combination with some of the lasers. So there's all sorts of things that we could do. And I think the important part here to understand is individualized treatment. When a patient comes in and meets with one of us here at any of the Greenberg Cosmetic Surgery Centers, whether you're talking about Manhattan, Woodbury, Smithtown, Southampton, or Boca, we meet with you, we figure out what bothers the patient in consultation, and put a package together that's so individualized. This is not a cookie cutter approach. Everybody's different. Everyone's face, nose, eyes, body is completely different. So we like to figure out what bothers the person. Okay. So if you guys don't have any questions about facial stuff, we're going to kind of flip down to the body a little bit. One of the most common cosmetic surgery procedures in the country is breast augmentation. Now, breast augmentation gets a little bit confusing because we can do breast augmentation alone. We can do it with a breast lift. Sometimes we do it with a breast reduction, Sarah.
Yeah, so talking about breast augmentations, we spoke a little bit about the Vectra imaging. So we can actually use an imaging machine to take a photo of your breast, and we can try on different implants, see what works best with your anatomy and your profile. So that's a great option here. If you just want some fullness and some volume, breast augmentation is great. If you have a little bit of a droop to your breast, we may need to lift you at the same time. We can do that with an implant or without an implant. And if you're having some shoulder drooping or your back hurts, you have too much weight on your breast, we can do a breast reduction that removes volume and it lifts them at the same time.
Yeah, for sure. So everyone has different problems with their breasts. Sometimes it's after pregnancy, sometimes people are born that way, sometimes it's massive weight loss patients.
So our massive weight loss patient typically will have lower hanging breasts, which we call breastosis. This is easily fixed by doing a breast lift. A lot of times with patients who lose a lot of weight, they lose that upper fullness that a lot of women want, and that's where that implant comes in. It's not shelf, it doesn't jump off your chest. It's a nice natural slope that looks very beautiful with a breast lift.
Right, so there's always confusion, Dr. Cooper, about should I get a breast lift or breast reduction? What's the difference between those?
Okay, so a breast lift addresses the droopy excess skin. And oftentimes, as was said before by my colleagues, we'll combine that with breast augmentation. Breast reduction addresses very heavy breasts. The patients have shoulder grooving, they have back, neck, and shoulder pain. And so not only do we reduce the excess skin that comes with large breasts, we actually reshape the breast mound beneath the skin. And we give the patients a brand new shape and a more youthful and more aesthetic shape. And one of the things that we also address, oftentimes, 100% of women are asymmetric before surgery.
Asymmetric or uneven?
Uneven. My plastic surgery is shown. And we can address that with any of the procedures that have already been discussed.
So frequently somebody will come to us and say, I have neck pain, I have back pain, shoulder grooving, rashes under their breasts. They can't wear the clothes that they want to wear. And Dr. Sabat, that's a perfect person for a breast reduction.
It most absolutely is.
Come in a little closer, guys.
Oh, sure.
So they can all see you.
So, as Dr. Greenberg and Sarah and Dr. Stark, Dr. Cooper were all saying, it's not just about lifting the breast. It's not just about reducing the size of the breast in case of a breast reduction. It's also about doing it in such a way that you're able to wear, a low-cut top or a top, snow's not going to last forever. Summertime's around the corner. And, all of our scars are basically hidden right around the nipple and below, at a point where they will not show in revealing clothing. So, we make every effort to make sure that you get the shape that you want in a way that's really inconspicuous, that no one will really be able to tell that you had surgery done.
Yeah, no question. So there's a lot we can do for breasts, making them bigger, making them less droopy, making them smaller, or any combination of those. And we can really aesthetically try to get that result that somebody wants. Let's turn our attention a little bit to the body. Now, when we're talking about the body, the second most common procedure in the United States is liposuction. And we do a lot of liposuction, both in women as well as men. Most common areas for liposuction are the abdomen, the love handles, the inner and outer thighs, the chin area, as well as the chest area in guys. Liposuction is quick and simple.
Lipo is super quick. Lipo sculpts the body and contours the body, so if you have some extra fat in certain areas that are really stubborn, can't get rid of them. A lot of the men complain about fat back here, the flank area, and the chest. Lipo is great to contour them. You're back to work in just a few short days. Your recovery is not bad at all. It's really simple to do. We can basically do any area that's bothering you. So belly, inner thighs, outer thighs, and then we can harvest that fat and transfer it to other areas as well.
Yeah, so we do a lot of fat transfers to the butt. That's called a Brazilian butt lift. We take the fat out of where we need it, we contour that abdomen, and we can build a nice butt. But the confusion always is, am I a candidate for a tummy tuck or am I a candidate for liposuction, and what's the difference?
This really leads us back to what we were talking about before, that every consultation is truly tailored to your body and your history and your needs and your goals. So if you want to have that flat washboard stomach, but you've had a lot of weight loss, you have loose hanging skin, then you may be a candidate for a tummy tuck versus just liposuction alone. Whenever we do a tummy tuck, we always combine that with some waist sculpting flank liposuction to really give you that hourglass contour if that's what you're going for. But if you have loose hanging skin before surgery, weight loss, things like that, tummy tuck is probably in your picture. But if you have some fullness, some recent weight gain, like Sarah was saying, it's for the stubborn areas of fat. You work out a lot, you eat healthy, but you just have these areas that you can't get rid of. You are a perfect candidate for liposuction.
And the mommy makeover, Dr. Cooper, is a combination of some of these techniques.
Yes, so the mommy makeover, after pregnancy, women are left with drooping breasts, they lose their superior pole fullness or the roundness on the top, they have the lax skin, and they have a weak belly wall. So what we do is we address all of those issues, and it's a few hours of surgery. It really doesn't take us a long time because we've done so many of these. And so we'll address the breast with either implants and or lift. We'll also combine that with a tummy tuck. And one of the things that we do when we do a tummy tuck is not only do we remove the excess skin, we create an internal corset as we bring the muscles back into position at the midline, and that also gives you a flat belly.
So the mommy makeover is a combination of usually breasts, belly, some liposuction, some cellulite treatment, and sometimes our modern mommy makeover procedure involves vaginal rejuvenation and labiaplasty.
So we're combining this a lot with the modern mommy makeover. Say that 3 times fast. So this difficult to do. So this targets the lower area. It helps to improve laxity. It helps to improve urinary incontinence, lubrication, and it improves intercourse. So we can do that while the patient is asleep. We can also do something called a labiaplasty, which Dr. Stark does, and that targets the outside aspect and helps with any extra skin.
So the labiaplasty is a quick and easy procedure.
100%. Sarah and I do a lot of this combination procedures that we were talking about. We call it the vaginal restoration. The vaginal rejuvenation is what she just touched on, but the labiaplasty is a procedure that addresses the external genitalia of a woman called the labia minora. A lot of women have this genetically. They can have this after childbirth and after intercourse. And for a variety of reasons that I talk about with my patients that are very personal to them, we decide whether or not they are a candidate for a labiaplasty. When you come in, it's a very personal journey that they have. Some women experience dryness, pain, frequent yeast infections. This is something that we talk about, and we talk about your options and if you're the right candidate for this type of procedure.
So the modern mommy makeover, so if someone has a kid or loses weight, we kind of put the package together and redo everything. Breast, belly, lipo, vaginal rejuvenation. It works really well together. All right, let's hop off of vaginal rejuvenation for a minute and hop into guys' chests. One of the most common problems that guys have, up to 35% of men at some point in their life have enlargement of the male chest. And this is secondary to a few different things. Sometimes the male chest is enlarged because of extra fat. Sometimes it's enlarged because of extra breast tissue, Dr. Cooper.
Absolutely, and we do a ton of these as well.
Talk really loud so they can hear you.
We do a lot of these. So we're seeing more and more men coming in as they become more comfortable with the concept of having plastic surgery. And I think one of the main things that we focus on is camouflage of the scarring. You might see when patients come in and they've lost a lot of weight and they have a lot of loose sagging skin, we really try and minimize their scarring. And it's usually a combination of liposuction as well as removal of the excess skin and removal of the excess breast tissue that's found underneath. And we try and do these through a scar that's just around the areola. We don't do that anchor cut scar because nothing screams, I used to have breasts as a male, than an anchor cut scar.
Okay, so just to summarize that, guys, very common procedure. If you have a little enlargement of the chest area, we can easily get rid of that. As Dr. Cooper said, a little liposuction, small incision around the nipple area, the areola, takes that away, and it is gone forever. It's been our procedure. So a lot of guys are doing cosmetic surgery procedures. The most common procedure in guys, as we said earlier, is liposuction. And Dr. Saba, they typically do the abdomen and love handles.
Absolutely. So, the modern trend right now is for a lot of, with people being more fit, more healthy, a lot of guys are exercising, going to the gym. So, especially when you start getting into that, 30s and 40s, the problem that tends to happen is that guys build up a lot of muscle, but they're unable to get rid of those hard to treat areas like the belly, the love handles, sort of like the fat belt that you kind of get around your abdomen. And sometimes the only way to get rid of that resistant fat is with liposuction.
Yeah, it works well. So lipo's great for both men and women. The guys like to bring in that waist. The women like to do the inner and outer thighs or the abdomen and love handles as well. Guys also do a lot of hair restoration. And the most common type of hair restoration is something called neograft. And neograft is a way to take the hair out of the back of the head and take the follicles out one at a time and transplant it into the front or the top. So we can help significantly with male pattern baldness. So you can see here at Greenberg Cosmetic Surgery, all of our centers, we do everything from head to toe. And between all of us, we have years and years and years of experience, and natural is super important to us. There are a lot of non-invasive things that we also do here at Greenberg Cosmetic Surgery. In a second, you're going to hear from our cool sculpting and end sculpting expert, Araxia, who's going to talk to you about how to freeze fat away and how to develop that six-pack abs that you've always dreamed of. Besides the cool sculpting and end sculpting that you're hearing about in a second, we do all sorts of other laser procedures. So fine lines and wrinkles, tightening up the body, getting rid of those red spots or sunspots. So Araxia, why don't you come on up and talk a little bit about cool sculpting and M sculpting.
Sure.
Talk really loud so they can hear you.
So we'll start with cool sculpting. It's a #1 non-invasive fat reduction treatment in the globe. There are 8 million procedures performed so far, and it's very popular. It's a permanent reduction. So anyway,
Permanent. So this is permanent?
Yes.
So let me just summarize this. It freezes the fat away, and you get rid of fat. What's the best areas?
Your best areas, I'm not sure about, but my best areas were my waistline and the love handles, the bra rolls in the back. People do it in the thighs as well. It works underneath the chin and all the way down.
And the arms too, right?
Absolutely.
So we're talking about cool sculpting with Araxia, our cool sculpting expert here at Greenberg Cosmetic Surgery. How long is the cool sculpting procedure?
That's a great question. It could be a lunchtime procedure. You'll probably do it during lunchtime. There's no downtime.
So you eat it during this?
You can eat. You can watch TV. You can read a book.
Can you eat cake and cookies and all that?
And the champagne on the top as well.
Okay, so it's good. This is good. So you're eating cake and cookies and you're freezing the fat away at the same time.
at the same time.
Yeah.
Yes.
It's amazing. So what is the difference between cool sculpting and M sculpting? Seems confusing.
So once you eat all the cookies and the champagne, all the fat away, then it's the muscle that is growing right now. I am here, I need some tightening, I need some build up because you haven't been working out because of all this here, what's going on. And we can actually build that muscle up. In half an hour, Dr. Greenberg, 20,000 contractions of that muscle is gonna work its way up. You're gonna build that six-pack away and be nice and strong.
Okay, so M sculpt is the equivalent of 20,000, if I heard it right, 20,000 sit-ups in a matter of a half hour. 20,000 sit-ups in a half hour. And what if you put the M sculpt thing on your butt?
The butt, everybody is talking about the butt. So it builds that butt up. It makes that illusion of the muscle that it builds itself up and gives you that amazing line that people want going from the thigh to the buttocks. And you cannot do it on your own.
Right, so the M sculpt, when you put it on the butt, it's the equivalent of 20,000 squats. When you put it on the belly, it's the equivalent of 20,000 sit-ups. It's actually really pretty cool. It works, does really well to build up those areas.
We can do the arms with it as well.
You do the
And
arms.
the legs, calf muscle, and it's very big as well. It's very important to build that up.
Right.
And we have specific applicator for that, which we can use to use on the muscle.
All right, so instead of going to the gym, if you can't make it to the gym, it's really hard to do 20,000 sit-ups or squats by yourself. But we can do that with the M sculpt machine. We do that in all the Greenberg Cosmetic Surgery and Dermatology offices. And if you're interested in that, just contact us. Araxia will be happy to review everything with you. She does these all day long, every day. Thank you, Araxia.
My pleasure.
So there's so many different things that we can do, as you heard. And I think that practicing state-of-the-art cosmetic surgery is so important. Using the best technology, we individualize these consults. So when you come in and see any one of us at any of the centers, you're going to get an individualized consultation, an individualized approach, seeing what is the best way to handle your specific needs, whether you're on medi spas or whether you're seeing one of us, Greenberg Cosmetic Surgery. I also just wanted to mention, we have a full service Greenberg Cosmetic Surgery and Dermatology Division. So a dermatology division by our board certified dermatologists. We're all plastic surgeons, but our dermatologists do everything else for the skin. Whether you have skin cancers or you have moles that you don't like, or you have acne, psoriasis, eczema, or any other warts or fungus or whatever it is, our dermatologists do all of that full service dermatology, whether it be Woodbury, Manhattan, Smithtown, Southampton. We're happy to see you for either our cosmetic plastic surgery or our dermatologist. All you need to do is contact us. Go to greenbergcosmeticsurgery.com, get all the information that you need there. Contact us on Instagram, and just give us a call. You can call any of our offices, 516-364-4200. We're happy to see you. We're happy to make your dreams come true. Great time of year, great time to do it, even though everyone's stuck in with masks, stuck in and not working, or working from home. It's a great time to recover, to reveal that Greenberg body for the summer. It starts now. This is Dr. Steven Greenberg, Dr. Stark, Dr. Cooper, Dr. Saba, Sarah, Araxia. We look forward to seeing you guys soon.
Winners?
Oh, winners. We have winners. So we have packages that we're giving out. What are they called? Raffles? Raffles that we're giving out. All right, let's pick a raffle. Okay. Who's going to pick the winners? Here are the winners. The following people, $100 Med Spa gift card winners. You reveal it.
Karina Jockers.
Karina Droppers. Oh my God, she gets $100. $100 to the Med Spa. Who else?
Carrie Olson.
Carrie Olson, good job.
Yay. Denise Latronica.
Okay, Denise, awesome.
Okay, Sarah McCandles.
All right, love that name, Sarah McCandles.
Elizabeth Lee.
Elizabeth, good.
And Cindy Damasi.
Okay, those are the $100 Med Spa gift card winners. Good job. Karina Jockers, Carrie Olson, Denise Latrocia, Sarah McCandles, my favorite, Elizabeth Lee, and Cindy Damasi. Now, the Deluxe Beauty basket winner. This is good. Beauty basket winner. I'll show it to you.
Ooh.
In the beauty basket, a
Whoa.
Greenberg hat. Wow, my favorite color of the Greenberg hat. A whole bunch of Cosmetic Surgeon jar and Sage products. A copy of my book. A $100 gift card. And something else.
Skincare.
So skin package. So this is the Greenberg Grand Prize. Deluxe Beauty Basket winner goes to
Terry Ahern.
Terry Ahern. All right, you guys, anyone want to come down and see us, give us a call, contact us, watch us on Instagram, follow me or any of the other doctors along on Instagram. We are happy to see you. Thank you so much for joining us. We hope that next time you see us in person here at one of our Greenberg Cosmetic Surgery and Dermatology offices. Have a great night, everyone.
Bye, everyone.
A little part of me was
We're not done yet.
Yeah.
Are we official?